Hello, my dear friends. Welcome to Aspire32. And today's podcast is very important for the orthodontist who really want to do MOrtho after their post graduation. And to guide us about MOrtho, we have Dr. Mukundan Vijayan, who is an associate professor in Government Dental College, Kerala. And sir has stood first at various levels. For example, his postgraduate exam, All India entrance exam, his BDS exam, and even the Public Service Commission exam. Sir has finished MOrtho from 4 different places. And that's why I'm sure today's podcast would be really helpful for people who always want more information about orthodontics. Welcome to Aspire 32, Dr. Mukundan sir, and it is really a great pleasure to have you. And looking at your achievements, which I just mentioned, I'm sure this podcast would be really helpful for most of the orthodontists there who want to learn about this ortho.
Thank you so much, Dr. Suresh. And I must congratulate you for on this initiative, having a podcast, spending your valuable time trying to help this budding dentist to gather whatever knowledge is possible so that they can go forward. It's really commendable.
This topic is really interesting, although I'm an endodontist, but I do have many colleagues who keep on mentioning about the ortho. And obviously, my first question would be, what exactly is this ortho, sir?
MOrtho is actually, it's an exam. It's an examination to confer a membership diploma. You have to understand this is not a degree. This is a membership diploma. So this is usually taken by, this exam is taken by people who have already completed a master's program, master's degree in orthodontics. But in order to enroll themselves as a specialist in orthodontics. Now, you have to think of this in context of UK. Okay, so this comes from the UK. So in the UK, if you have to become an orthodontic specialist, even if you have completed a master's program, you have to pass this exam. So this is a membership diploma. And after passing this exam, you can enter into the specialist register. So this is the exam to become a dental specialist in the UK.
So this ortho, what exactly is the full form of ortho, sir?
It's membership in orthodontics. But
okay.
the degree runs a little further than that.
Okay.
It's MOrth, RCS, and then comes the name of the college. So RCS means Royal College of Surgeons.
Okay.
So
okay.
There are 4 degrees. MOrth, RCS, Ed for Edinburgh. MOrth, membership orthodontics from Royal College of Surgeons in Edinburgh. Then MOrth, RCS, ENG for England. MOrth, RCS from RCS England. Then MOrth, RCPS, that is Royal College of Surgeons and Physicians and Surgeons, Glasgow. Then you have one from Ireland as well, from RCSI, that is RCS Ireland. That is called FFD.
Okay.
Fellow Faculty of Dentistry in Royal College of Surgeons, Ireland.
So I believe that someone who is an orthodontist, only they can appear for this exam, or any other. It may look very silly, but I'm just curious whether undergraduate student can appear to this, or only is it restricted to orthodontist?
It's a very good question. If you are from the UK, it's a very good question. If you are an aspiring MOrth candidate from India, of course, there are not many options. For you to take MOrth, you have to complete a 3-year training program, full time. Okay. And if you have completed a 3-year supervised post in orthodontics, like you get appointed in the UK, you get appointed to an orthodontic job. Okay. But you have only the basic degree, like similar to the BDS in our country. But you are doing orthodontic cases under the supervision of an orthodontist or specialist orthodontist. And if you have done that for 3 years, then again you became eligible for this. But that applies only to the UK. Now, if you are from India, then you have to have a 3-year specialist training program completed before you can take this exam. So that is, you have to complete your MDS in orthodontics to take this exam.
So someone who is just finished with orthodontics, MDS orthodontist, they can directly appear for it? Or is there any further experience, like after MDS you have to again 1 or 2 years and then you are eligible to this, or just MDS is sufficient?
Yeah, just MDS is sufficient. In fact, the exam consists of 2 parts. Part A and Part B. So Part A is written. Part A is written and it has two components, basic sciences and clinical sciences. To appear for Part A, you just have to complete 2 years of this special training program. So if you have completed your second year in MDS, you can appear for Part A. Okay, but there is a small catch there. The portions included would be for the entire 3 years. So, but you can, if you don't want to take all this stress during your first examination, that is Part A and Part B, if you are trying to take it together, maybe you will get a little bit stressed up. So you can split it up and take the Part A after 2 years, because it is theory. You can finish it in 2 years. And Part B is the clinical exam. That can be taken up only after 3 years of completing 3 years of training program. So you complete your MDS and you are ready. You can take Part A and B together, or Part A separately and maybe Part B later, maybe within 2 years. But if you take Part A and Part B together, there is no additional fee for Part A. There is an examination fee for Part B. You just have to pay the examination fee for Part B to take Part A and B together. But if you take Part A separately, as a standalone exam, then you have to pay £250 extra.
So what exactly is the usual procedure, sir? Like if somebody wants to appear for this MOrtho, what is the general procedure like?
First is that you have to complete your MDS. Then you have to wait for the announcement of the examination dates. So you have to keep looking. There are 4 colleges, so you have to go to the website and keep looking. So they will schedule exams throughout the year. Especially Edinburgh has so many centers, so they will schedule exams probably in Colombo, Dubai, Singapore, then in Latvia. Sometime before there was Cairo, then of course in the UK as well. In the website there will be the application form. So you download it, you fill it up. For filling it up, what you need is the routine stuff, that is your address, all those things. Then you have to put in a copy of your primary qualification, that is the BDS, and a copy of your specialist certificate, that is your MDS. Then you have to have signature of your supervisor. It doesn't mean HOD, your supervisor. So probably your guide, even though he is not the HOD, he can give you the signature. And you need the signature of head of the institution. So you need your principal's signature as well. Yeah. So these signatures, plus then you have to take the check, which is the most important thing. It is not very cheap. I think it is around £1,250, 1.25 lakhs exam fee. So you can either pay it in check or a draft, or you can use your card and do all this, put everything in an envelope, and you have to post it to Edinburgh. And they will scrutinize this. Most likely they will admit you. It's very seldom that they don't, because of course they need candidates. Whether you pass or not, it is not their prerogative. They will accept it. If you have put in all the certificates required, you have demonstrated that you have completed 3-year training program, you are admitted. And then they will intimate you that you are admitted, and your Part A will be on this day. Then probably your Part B will be on this day. So you have to go and take the exam. It's a very well structured examination, I must say.
Yeah, and many people did tell me that my orthodontist friends, they tell me that this is very tough also. I don't know, you have done so many orthos. There are people who struggle for one M ortho, which, there's people think so much before applying M ortho. I have not come across someone who has so many M orthos in this branch, and I really want to know more about it. But there is one thing, sir. I heard it, but I'm really not sure whether you have to submit your cases with your application form. Do you have to do that?
Not with your application form. Not with your application form. When I did my exam, you just had to take your exams with the case records. I think now you have to send in your digital records as well, because now you have e-models and probably photographs. That has to be submitted probably a few days before this. And they will evaluate it, and probably they will be better prepared with the questions. But then again, you don't have to submit it with your applications. They are not like your admit card to the examination. You apply and then you get selected. And once you are selected, probably you will have to submit it at a few days earlier, maybe 1 or 2 weeks earlier, like that. Not much earlier before the application, no.
And do you have any Indian office to help you with this communication, or it is totally an international affair?
It's totally an international affair. I mean, it is done on an individual basis. If you have to apply, then you have to apply it yourself. Probably someone can apply it for you, but then again, there is no place where you can, go as a group and then apply. It is like you have to do it on an individual basis, make the payment on an individual basis, and then send the application individually.
And how do you prepare, sir? You said the first exam is a theoretical exam, part A. The second one is a practical. Is it practical, sir?
Yeah, it's practical. Practical means clinical, basically. Little bit of practical stuff is there. More of it is basically clinical, diagnosis, treatment planning, all those.
Okay. And how do you prepare for this theory exam? Because I'm sure the exam may be a really difficult one, because it's a foreign exam and they usually tend to keep it very specific. Do you recommend any way to prepare for this MOrtho exam?
At the outset, I must tell you that our MDS exams are tougher. So it should be reassuring for the aspirants, because we have lots of stuff to study. As you said, their exams are very specific. You don't have to horizontal learning. Like you don't have to learn every this and that. You just have to be thorough with certain specific things, which is clinically more important. So I would say that the knowledge, the skill, the competence that comes from your MDS course, that is sufficient. Only thing is that you just have to orient yourself a little bit for this exam. That can be done after you have done your MDS. So when you are doing your MDS, you devote your time and your energy to do a very good postgraduate program. You get your finished cases. You have to have 4 finished cases, 4 of them. So you do your course with utmost dedication and sincerity. Study well. Whatever is in your curriculum, you study well. Prepare your cases. And once you have done a good MDS, I think you are, say, 70% there. The rest 30% is just orienting yourself for this exam. Now, orienting yourself means you have to gather information, because this is an overseas examination. Now, we have centers very close by, Colombo, then even in Chennai, Glasgow is conducting exams. For the last 2 diets, they were online, I think, but then it's a temporary arrangement. But previously, the closest was Singapore, then Dubai came in, and Cairo was there, but they were very, very far away. So when you go to a very unfamiliar place, and you are paying a lot of money for the exam, and plus your, the travel expense, all those things. So this is not child's play. So you have to be in the best equipped position as possible.
Give your 100% when you know that you have the exam, rather than giving a half-hearted effort.
See, you have to be prepared. Because there are so many unknown variables. You can't be 100% prepared because you don't know what's coming. So you gather information. If you ask me, the best information that you get is previous candidates, especially people who are close to you, whom they will give you, very sincere advice regarding how to go about it. If those who have cleared the exam, even those who have not cleared the exam. Okay, I have had help from people who had not cleared the exam, and it was very, very helpful. They were so unselfish, and so that is one way of gathering the information. And then there are certain orientation courses. They have one in Chennai now, where people come down from the UK and give you an orientation. Then there are certain MOrth training programs which fellow orthodontists they conduct. Every once in a while you get this intimation. From wherever possible, you collect your information, and then you are in a very good position, because you have done your academics well. You have gotten your 4 cases ready. Now you have fair idea about how things pan out. It's a 3-day exam. So how things pan out, then you have your timetable. You can, plan your
This first exam also is 3 days, sir. Are you saying that the first exam is 3 days, or is it the second
No,
exam?
part A is like it's a written exam. So
1 day, sir. 1 day exam.
Yeah, it's a 1-day exam. It's for Edinburgh. It's 2 sessions.
Okay, so it varies depending on which MOrtho exam you are appearing.
Yeah, it varies slightly, but more or less
it's a 1-day
pattern
exam.
is a thing. Yeah. So for Edinburgh, there are 180 questions in part A, and they have split it into 2 sessions, 90 questions of 2 hours each. So they are called SBA, short best answer. See, very similar to multiple choice questions. They might have choices which are correct. They might have choices which are more correct, and they will have a choice which is the best. So you have to pick out the short best answer. So 90 questions, pretty basic questions, but very, very pertinent questions. So if you just learn the high-flying stuff, that won't do. You have to know the basics well. They test you for your basic knowledge. You have to have a very good foundation in the subject. You have to have the competence and the knowledge and the skill at the level of a practicing orthodontist. So that is what it has to be reasonable. You don't have to be excellent, but a reasonable level has to be. So this is how you collect the information. Then there are certain textbooks. These are, as an endodontist, my wife is an endodontist, so these textbooks. I have seen her textbook, Masuk, then this thick, these books. And of course, our textbooks are not this. Your textbooks are bigger, I would say. Maybe this. But when you look for this MOrth text, they are this. And mostly in the size of a notebook, not the big one, not the big A4 size. So they're very small books, but full of points. Yeah, so one is a textbook of orthodontics by Houston and Tully. It's a pretty old textbook, but it's a standard textbook of orthodontics, Houston and Tully. Then an introduction to orthodontics by Laura Mitchell. Then Handbook of Orthodontics by Martin Coburn. Diagnosis of an orthodontic case by Fraser McDonald. Then Clinical Problem Solving in Dentistry, mainly in orthodontics and pediatric dentistry by Dr. Declan Millett. He's from Ireland. Then Postgraduate Notes in Orthodontics. That is most followed one. Postgraduate Notes in Orthodontics. It's popularly known as Bristol Manuals. It consists of many references. So if there is, for example, a topic on functional appliances, so they give you references, the use of functional appliances, and they give you references. So you have to go and refer those articles. Even though the book is very small, if you want to complete it, it takes a long time. But once you complete it, you will get a fair idea of how to treat a case because it is evidence-based. All references are there. So these are a few textbooks.
Do you recommend them that they should also go through the recent literature, meta-analysis, which they might find in the exam useful?
Yeah, these Bristol manuals, they have, they updated, every now and then they updated. So they might have a few recent articles to suggest. That would be enough. They don't go like so gung-ho about the recent advances and the groundbreaking stuff.
Okay. And how about the second exam, sir? Second part of the exam.
Yeah, second exam, it's mainly clinical. They test you for your knowledge and competence in diagnosing a case and then planning the treatment, and finally a little bit about carrying out the orthodontic treatment. So it consists of mainly 4 sections. So first section is they evaluate your finished cases. You take 4 cases, right? So they have gone through it and they have made notes on the cases. Probably they will discuss 2. Sometimes they will discuss 4. Sometimes they will discuss just 1. It depends on them. Again, one point about the finished cases. They don't have to be big, very difficult cases. They don't have to be that. You can have cases of moderate severity, but it has to be finished well. And then you also have to have a very in-depth knowledge about how you have treated the case, what you have achieved and probably what could have been better. Most of the students, most of the candidates, they present cases which were done during their postgraduate time. So there is chance that they have gone a little bit, off track. If they point that out to you, you can of course admit that yeah, that has happened. But I know that probably if I had done it this way, this would have been better. So they would be satisfied. So they will think that okay, this guy knows what is happening. So that is what they test. So you don't have to set the exam hall on fire. You just have to stick to your basic. You have to stay strong to your basics. That would do. And so I was talking about the second part B. So the first part is 4 finished cases. Then after that, you have a section where they bring in some cases. They give you models, photographs, radiographs with some supplementary values. So you have to go through them. You have 15 minutes to go through the records of one patient and another 15 minutes to go into a room and discuss this case with 2 of your examiners. So there would be 4 such cases, 4 of them. So that is the second part. The third part is for some colleges, it is called OSCE, Objective Structured Clinical Examination, where you have stations and there are questions, there are exercises. Sometimes you have to do a wire bending at a station. Sometimes you will be given a radiograph. You have to draw the cephalogram and do an analysis. Sometimes they will be given a study model and you have to take measurements from it. Sometimes there will be a patient sitting there and you will be given a scenario that this patient requires this sort of a treatment, say extraction correction. Now you explain the various aspects of this treatment to the patient and convince the patient to this treatment. Sometimes you will have ethical issues, like one very interesting scenario is you have a dentist sitting in a station. The situation is this dentist has done some sort of a orthodontic treatment. Dentists without specialty can do orthodontic treatment, but they have missed out on an impacted canine. Okay, so the patient was not very satisfied with the outcome of the treatment and they have come to you for treatment, and you, after taking the radiographs, you found out that there is an impacted canine and you have made the patient aware that there is an impacted canine. Now the patient is very, very livid and angry that the other dentist has not informed him or her of this situation. So the patient has filed a lawsuit against this dentist. So you are confronting this very angry dentist, and who is going to be very, very angry. I tell you, at one point, I even got scared that she is really angry with me. And so you have to deal with it. Then you have certain, guidelines, how you deal with these legal issues with the patients, with the referring doctors. So these are called objective structured clinical examination stations. So that runs around 2.5 to 3 hours, I think. Some 18 stations, and you will have some 7 or 8 or 9 minutes per station. The pattern slightly changes every now and then. So that is the component 3, and the final component is grand viva, which would be 30 minutes. They stop exactly at 30 minutes. So if you get your favorite topics for 30 minutes and you just go on talking, and they don't get to ask other questions, but they will just stop at 30 minutes. And they don't ask very difficult questions, or they ask basic stuff, but they will make sure that you are not bluffing away for your exam. This is an exam where you can't bluff away for 3 days. It runs for 3 days, and probably you can fake a bit, but at the end of 3 days you will be found out. So get your basics right, and this exam is not going to be very, very difficult.
You have so many MOrth, sir. I have very little knowledge about it, but you did mention the important aspects of it. I have 2 questions related to this. One, I went through your CV and your resume. You have stood up first in entrance exam, BDS, and your postgraduate exam, so many things. And then how did you keep yourself motivated that, okay, I have to do that MOrtho again?
Actually, my institution, I did my MDS from GDC Trivandrum. And when I joined for my course, my department was an examination center for MOrth RCS, Edinburgh. So in my first year and my second year, I used to see candidates from all over India come down to Trivandrum and take their exams. And I used to see that this was a very, very well-structured examination. They have rules in place, protocols in place. So I was very, very impressed with the examination itself. And we used to get chance to talk to this very, very eminent orthodontists who were coming down to Trivandrum for this. So probably seeing this exam, pan out in front of my eyes and seeing these very eminent orthodontists coming and taking this exam, and finally, to see the joy of completing this exam successfully, probably that inspired me. And once that thought was planted in my mind, probably I didn't let it die down. And after I completed my MBS, the next year, for the next night, I appeared and I went to Singapore for that, and I cleared. And then I thought, okay, I have achieved something and I'm very happy about it. But after a couple of years, I thought, I'm getting stagnated a bit. So then I inquired whether there are other exams that you can take. It is then that I came to know that there are other Royal Colleges. I applied for MOrth at England, and my application reached late. They had mentioned the last date as one Friday, and it reached the office on the Friday, but it was a Good Friday and the office was closed, and they received it on Monday only. They promptly sent it back. So that probably, that upset me a little bit. I was thinking that, they have done this injustice to me and I'm not going to back down. So what I did was that year I went to Ireland and gave the exam there. And in fact, Ireland was not in my mind. So I did that, and by God's grace, I got through that. Then when the next year came in, I was thinking, anyway, last year they rejected my application. Probably it is time to apply for it again. So I applied, and probably this, this sense of fulfillment, this satisfaction of completing this examination, it just kept me rolling. And this feeling is indescribable, especially when you go to faraway places. I have treaded this paths alone. I didn't have examination centers anywhere near to India. The closest was Singapore. Then I had to travel to London, to Edinburgh, then to Dublin. So you go to these very, very unfamiliar places. You are alone in the crowd, and probably you are the only person of Indian origin. All of them are whites. Of course, Singapore had so many Indians. There were a couple of guys from Davangere. There were a couple of guys from Dharwad. Pretty good friends. I think my very good friend, Dr. Preeti Mulimani, she worked in Belgaum. She's in the US now. We all took the exams together. But again, you are very, very unfamiliar with the situation, the challenges, the standard of the examination. Always, when you go to a center, you are equated with respect to the local candidates. So when you go to Singapore, Singapore has a very, very state-of-the-art university, NUS, National University of Singapore. So you are equated against these candidates. So again, that is very, very challenging.
That's nice, sir. And as you said, the challenges always keeps you motivated and helps you to, because I know that everything becomes stagnant at some point of the time. And as you said, these challenges were really helpful. Of course, now maybe it is easy to appear for these exams than for you what was there during your time. What is the current benefits, sir, apart from what you mentioned, that is absolutely right, that when you have cleared the exams, you are at par with those students there. What other benefits MOrtho candidate can get with these degrees?
Then it gives you a sort of recognition. It gives you a little bit more respect in the specialty. Then if you ask me about the benefits with regards to your job or placements, Dental Council of India does not recognize this degree. So you won't get any benefit on paper. But if you go to an interview as an expert or something like that, your opinion would be valued, or you stand a greater chance for selection because you have one additional degree. Everyone in the specialty knows that this is a membership degree diploma from the UK, and for a UK orthodontist to get enrolled in the specialist register, you need to clear this exam. So this guy has MBS as well as MOrth. So you stand a better chance for selection. See, I work in the government service, and for that I had to go through a test and the interview. And for the interview, probably I got selected because I had an additional qualification. I was selected first, and I was the at that time, that was 2008. So I was the only person with this additional qualification that time. So probably the board, there were a board of some 3 or 4 people. They thought that, all other people have MDS. This guy has one additional qualification, so he should get. And probably, I performed well for the interview as well. But again, it gives you a better chance. So that is one thing. Then, if you are aspiring for jobs in the Middle East, say in Dubai or Qatar, or sometimes you are exempted from examinations. If you have more than one, well and good, because if nowadays it is becoming more and more common, because centers are there around our country, and even in Chennai also. Chennai had only one type of examination, but still the world is becoming smaller. So there are more people with it. If you have 2 degrees, probably if you have 3 or 4 people with 1 degree, you stand a better chance than them. And even though DCI does not recognize it, if you apply for a DCI post, of course, they will consider this. These are all, off the books, but it happens.
So one last question here, because you have covered everything very nicely, and I'm sure if somebody has any doubts, they can always mention in the comment section, and I can ask you and reply to them. What is your message to these students or the orthodontists, a concluding message for these orthodontists who want to appear for this MOrth?
First and foremost, you have to think that this is possible. This is very much possible. Only thing is that, you have to have the will and the determination and, this mind to work hard for this goal. As I said earlier, it is not as tough as your MDS examination, but your MDS examination forms the base for this. You gather your knowledge and skill and competence from your MDS course. And if you have this dream, you just nurture it, go through your MDS, you keep an eye open for this. Then after you have completed your MDS, just reorient yourself. This is not very tough. You just have to have the will for this, and you have to work hard for it. And this is well within your grasp. I would feel that education is much better in India than in the UK. I have gone there, I have talked to people who have done MDS from very reputed colleges. And I think, our curriculum is, much diverse and much, it prepares you much better than a course in the UK.
Thank you so much, sir, for giving your time and all this precious information, which is very difficult to get when somebody thinks of an foreign degree. And I'm sure you are the guide for all the students. You are a ray of hope for someone who is actually thinking of preparing for MOrtho. Once again, thank you for your precious time, and thank you for coming on Aspire 32.